Good afternoon. I'm Pat Living with the Department of Health and Social Services and your moderator for the COVID-19 update for Wednesday, January 13th. We are joined today by Yukon Premier, the Honourable Sandy Silver, and the Yukon's Chief Medical Officer of Health, Dr. Brendan Hanley. Once again, our sign language interpreter, Mary Thiessen, and André Boursier from French Language Services Directorate have joined us. Following our speakers, we will go to the phone lines for questions from reporters. We will call you by name, and you will each have 2 questions. Before we begin with our speakers, I'd like to verify that everyone can hear us. If any of the reporters are having a problem, please email eco@gov.yk.ca. Premier Silver?
Thanks very much, Pat. Thank you, everybody, for joining us here on the traditional territory of the Kwanlin-Dun First Nation and the Ta'an-Quachin Council. I'm very pleased to be here again with Dr. Hanley and Mary to update Yukoners on our current COVID situation in Yukon. I would like to take a moment as well to acknowledge recent events in our territory. The community of Mayo has suffered major loss, and our thoughts and prayers are with that community today. We send them love, support to the community at this time. I would also like to acknowledge the recent fire in Whitehorse, and I understand that a majority of the residents have now been able to return safely to their homes, which is good news. Yukoners share so many connections, and I know that these events are affecting many in our territory. So again, our hearts go out to folks that are involved. But again, please reach out if you need help. The help is available and supports are available. Vaccines, Yukon's vaccine efforts are moving ahead very quickly. The dedicated and hardworking team of health professionals continue to administer vaccines to Yukon's most vulnerable populations and also frontline workers. At the end of the day yesterday, 685 people received the first dose of the Moderna vaccine. We know that our next shipment of vaccines will arrive this week. This will be another allotment of 7,200 vaccines. This new shipment will help to keep us moving forward with our immunization plans. The online appointment booking system is now open. It is available for people in Watson Lake, Beaver Creek, and Old Crow for right now. Bookings for appointments in Whitehorse will begin in the coming days and will start with vulnerable people and those over 70 years of age. To avoid an overload of bookings, the system will be open 2 weeks of bookings at a time. On Monday, the mobile team will begin immunizing people in Watson Lake. They will be in the community on Monday and Tuesday. On Thursday, immunizations will be offered in Beaver Creek, and on Friday they'll be offered in Old Crow. In advance of the clinics opening in these communities, vaccine teams have been working closely with local leadership and agencies to ensure a smooth rollout. Information about these rural community clinics will continue to be shared with First Nations, governments, and mayors in the communities and will be shared broadly with all Yukoners. We are working very hard to reach all Yukoners with key details about the vaccine clinic dates and times. Look for information to be shared online, via social media, on the radio, and in the territory's newspapers, and of course, during these weekly updates. I strongly encourage everyone in these first 3 communities, and in every community, who is eligible to get immunized. There is no greater community action that you can do these days than signing up for a vaccine. The goal is to protect everyone and to stop the spread of COVID-19, which means it is most effective if everyone who is eligible gets vaccinated. We are working towards getting 75% of the adult population vaccinated over the next few months. On Monday, the clinic in Whitehorse will also be open for certain groups. For these first weeks in Whitehorse, immunization will be available to high-risk healthcare workers who may care for or be in contact with COVID-19 patients, older adults starting with 70 years and older, people who are marginalized and living in group settings like the Whitehorse Emergency Shelter and Whitehorse Correctional Center. There is This is absolutely great news, and I'm very happy with how the vaccination teams, how hard they're working to keep the vaccines rolling out. As we continue this effort, remember, we all have a role to play in keeping the territory safe and healthy. And I've said this many times, and I'll say it again, the best thing that Yukoners can do to prevent the virus from spreading now and through the vaccine rollout is to practice the Safe Six. Wash your hands often, maintain that physical distancing, staying at home if you're sick, traveling responsibly and respectfully, self-isolating as required, and also following the guidelines, the gathering guidelines that are in place, including limiting indoor gatherings to 10 people. Now, I've said this so many times. I'm saying it quick, sorry, Mary. I've been saying that so many times that I must stress this again. Please continue to practice the Safe 6+1. Mask up when you're in public. Yukoners, again, we're still not out of the woods, and COVID-19 continues to be a risk to each and every one of us, and we must all do what we can to reduce the spread of this virus. Before I pass things off to Dr. Hanley, I want to remind Yukoners that the vaccine schedule continues and information will be updated on yukon.ca. I appreciate that there are people who are anxious about getting the vaccine, and that's wonderful. I think a lot of people are really anxious and really looking forward to when it's their time and when it's their turn. There will be an opportunity for everyone who is eligible to get vaccinated when your turn comes. The Yukon government will share information about why you should get vaccinated. If you're not certain, evaluate the facts and use trusted sources to educate yourself about the vaccine. The development of COVID-19 vaccines has seemed fast, but this does not mean that safety has been compromised. As you wait for your turn to be vaccinated, stay vigilant, Yukoners. And please remember again to be kind, patient, and respectful and excellent to one another. So thank you very much for listening for this part of the update, and turn things over to Dr. Hanley.
Thank you, Premier Silver. Good afternoon, bonjour, bon après-midi, everyone. And like the Premier, I want to first acknowledge how difficult a week it has been for some Yukoners, particularly those in the community of Mayo and in Whitehorse. For my update, I wanted to focus briefly on the antibody test kits that some people have received and lots of people are asking about. And then really to bring our focus onto the vaccine rollout and elaborate on some of the points that the Premier has made. First, a little bit of a case update. We remain with the 2 family household clusters previously identified, and they're all doing well. So we have 6 active cases still and no new cases. All of those young people who were instructed to self-isolate when we were talking about this last week have since been able to resume regular activities after the individual with a preliminary positive test turned out to be negative on the gold standard PCR testing. So I'm pleased that as part of our contact investigations last week, we did take that proactive approach to a suspected case, avoiding the possible spread of virus throughout the territory, and that remains our ongoing goal and approach. Every now and then I hear someone speculate about that illness that they had back in the spring or even last winter and wonder, could that have been COVID when I had aches and pains and a cough? And that's the question that the recently launched StatsCan survey is trying to help answer. You may have recently heard on the news of people around the country receiving packages requesting a blood sample. And I've received some questions about, is this something legit? Is this a scam? So yes, this is in fact a legitimate survey launched by Statistics Canada. And StatsCan began sending out kits, including gloves and alcohol swabs and a needle to poke your finger and a filter paper for a blood spot sample. And this is part of a national survey to determine how much COVID-19 infection is out there, apart from what we already know from the testing results that we see every day. 48,000 Canadians, including 1,000 Yukoners, have been selected randomly to do a COVID antibody test. And the test will determine whether in the past you may have unknowingly contracted COVID-19, and then match that to any symptoms that you may have had in the past using a questionnaire. For those already vaccinated, it will also help to identify whether antibodies are present as the result of receiving immunization. This test will be used for research purposes and, of course, is completely optional. But this is a great chance for us to get some extra information on what COVID activity might or could have taken place in Yukon without us knowing. If you receive a test kit and choose to take part, all the information will remain confidential. Once you send in your test, you'll receive your results, your own results, a few weeks later, and all results and personal data will be protected under the Federal Statistics Act. And that study will continue until March 2021. Well, there's been so much activity and excitement this week about COVID-19 immunizations as we enter our second week of the campaign. We're well underway with immunizations for long-term care residents and staff. The first trip into Dawson was today to cover MacDonald Lodge and frontline healthcare workers there. And today, Whitehorse General Hospital is also busy vaccinating their frontline staff with a fantastic uptake. Meanwhile, the two mobile teams are finishing their preparations for their community campaigns beginning next week. And the mass immunization clinic in Whitehorse will open for elders and some specified vulnerable populations. Uptake so far has been great, and I've heard of very few people holding back or hesitating. But as we look forward, we have to acknowledge that while some are almost knocking down the doors to get vaccine, not everyone may be ready to step forward right now. That's normal, and we'll continue to support you with what you need to get you to come forward. I hope that as more people get vaccinated around the country, around the world, as well as locally, and as we continue to publish more information about the Moderna vaccine, and we learn from the rapidly growing global experience of the vaccine, that people will feel more and more comfortable to step forward. We have been navigating our way through this pandemic for almost a year, and any progress towards renormalizing our society will depend on a maximal uptake of the vaccine. We all want and need to get back to that time when we can reopen our economies, welcome visitors and tourists, re-engage with each other in the ways that, as innate social beings, we need to in order to thrive. Achieving herd immunity is a critical part of that success. We are working hard, as are people around the world, on how we can plan for easing public health measures when we have a vaccinated population. But we need to have that achieved. A population which we can say has enough vaccine in arms to prevent circulation and significant transmission of COVID-19. Our goal is that COVID-19 becomes just another one of those occasional illnesses rather than an epidemic threat that holds us all at gunpoint. Many of us have not seen a pandemic take place in our lifetime. It's an unusual time that typically leads to some hesitation and uncertainty. And we deal with uncertainty every day for sure. But to reemerge safely over the weeks ahead, we need Yukoners to stand up and lead the charge, encouraging those around us to receive the vaccine. Otherwise, 2021 could be much more similar to 2020 than any of us would like. As the Premier says, immunization is extremely safe and effective. All vaccines go through a rigorous regulatory scientific review process for safety, quality, and efficacy at Health Canada before being distributed to the public. And as our elder Agnes Mills said last week, we would not be here today without vaccines. Of course, in Yukon, we have been counting our blessings. We have fared well in comparison to other jurisdictions throughout Canada, not yet feeling the brunt of this second wave anywhere near to the extent that others have. Because of this, it's possible that some people may not see the need to get the vaccine. Our risk, however, of contracting COVID-19 is still high, as is the risk of importing the virus, and we know how contagious this virus can be once it gets here. Hospitals are nearly at full capacity in areas like Manitoba, Saskatchewan, Ontario, Alberta. The statistics tell us that currently 4% of the Canadian population has contracted the virus. 1 in 13 has been hospitalized. 1 in 10 may feel long-term effects of the virus. And unfortunately, 1 in 40 people with confirmed COVID infection have died. Compare these risks to the promise that the Moderna vaccine offers with a safety profile that is remarkable. Of course, there are adverse effects, such as pain at the site of injection, possibly a fever post-immunization, as well as the possibility of severe allergic reaction, although a very rare occurrence. Allergic reactions can be treated on the spot at any site where Moderna vaccine is being offered. These effects are mere inconveniences compared to the enormous benefits of preventing COVID infection. Post-marketing surveillance means that we don't rely only on clinical trials to know these vaccines and their potential for side effects. As the vaccines continue to go into thousands and millions of arms, there have been no reports of unexpected side effects to date. This is good news. We need to consider this and weigh our risk of contracting COVID-19 versus our risk of immunization. We know that although Yukon remains in a steady place right now, this can change in a matter of days to weeks. On the other hand, within just 3 months from now, we can see our population approach herd immunity, a chance that very few places in Canada have. As long as our vaccine supplies come in as scheduled, we are set up for a campaign that will be remarkable for pace towards that 75% or higher goal. If we fail as a community, we have to live with the risk of seeing our community thrown into further disruption by a wave of COVID-19. We continue, of course, to roll out the vaccinations, and the pace will be picking up significantly in the days and weeks ahead. This week is about finishing our long-term care sites for their first doses and adding immunization for healthcare workers involved in frontline care of people who may have been exposed or may be harboring COVID-19 infection. Next week is our move into the communities, along with certain vulnerable populations in Whitehorse. There are many ways to define who is more vulnerable to COVID infection or to the consequences of infection. People may be more susceptible to COVID-19 because of their age, because of where they live and who they live with, because of health conditions or socioeconomic status. All of these factors heighten the likelihood of an individual's risk of contracting the virus or having complications from the virus. To preserve our workforce for the people protecting us all from COVID infection, we're also covering our frontline healthcare workers, whether at testing sites, in EMS, the hospitals, or in public health and community nursing. We are already covering long-term care staff as we go through the various long-term care sites. Again, I want to emphasize that as the Premier says, within a matter of weeks, any adult who would like the vaccine will have a chance to get it. We are organizing the mass clinic in Whitehorse to get as many people as possible through day by day. We are not in the situation that the provinces are when they have insufficient vaccine, so they need to prioritize certain populations for this first quarter of 2021 and ask others to wait. We will get to everyone. But for the purposes of organization and efficiency, and acknowledging that there are certain risks that do take precedence, we are proceeding in a certain order. The two key questions, therefore, are, how old are you and what setting do you live in? For an individual, by far the biggest risk factor is age. The older you are, the more likely you are to get severe COVID-19 and to die from COVID-19 disease. Age in itself is a much more important predictor than other conditions such as chronic medical conditions or immunocompromise. Second, there are certain settings where we worry more about the risk of outbreaks or widely circulating COVID-19 virus. That includes our rural communities and what we call congregate settings, such as the Whitehorse Emergency Shelter and the Whitehorse Corrections. People who live in marginalized conditions as well fall into this category. either because they are individually more susceptible or because they are living in unstable settings where spread of COVID infection may happen more easily. That is why our current focus is on these groups: older individuals, communities, group settings, and marginalized individuals. So starting next week, booking will be available, as it is this week as well, for the high-risk healthcare workers who may be caring for or in contact with COVID-19 patients. And next week, the older adults starting with 70 years and older will be added, as well as those people I mentioned, people who are marginalized and living in group settings, such as the Whitehorse Emergency Shelter and Whitehorse Correctional Center. All of the other categories that I mentioned will be covered once the February 10th clinics in Whitehorse are open. Until then, we will be concentrating on ensuring that our elders have every opportunity to get vaccines earlier, starting with citizens 70 plus and working our way downward by age bracket until we get either vacancies in booking or get to February 10th. That, in a nutshell, I hope, explains our prioritization process. As we open up the Whitehorse Mass Immunization Clinic, individuals will be asked to register and book an appointment. I think as of today, we're unable to accept bookings via telephone, but bookings I know will be available very soon through a call center. And bookings can be made online if you're identified as a priority group per the schedule, as the Premier said, when your time in those next 2 weeks is due. So to book online, you must visit the yukon.ca. This is our shot, and that's linked from the main COVID website now. And then you input your Yukon healthcare number. If you wish to book via telephone, then I think beginning Thursday, that will be available. So I think hopefully that gives an overall kind of snapshot of where we are and of the vaccine prioritization process for Yukon. And remember that we are really putting everything we can into getting 75% of Yukoners or more to be vaccinated as our goal. And that is our real baseline before we contemplate further steps around public health measures. As the Premier said, always remember, meanwhile, the safe 6+1. Use your mask as well as all the steps that the Premier outlined. And this is the best way to protect ourselves from COVID-19 and until we get well past that point of a vaccinated community. That's all for my update. Thank you. Merci, Masicho. And remember to take care of each other and stay well.
Thank you both. We'll move now to the phone line, and we'll begin with Luke, CKRW.
Hi, Dr. Hanley. By the time that the vaccine clinic in Whitehorse opens for the general adult population, it will also be, at least according to the manufacturer's timeline, the time for our long-term care residents to get their second shot. Do you anticipate that happening on time, people in long-term care facilities receiving their second dose?
Yes, so that's very much part of the planning, of course, that speaks to some of the complexity of planning a kind of a whole population approach to COVID-19 vaccination, recognizing that it's a two-dose vaccine. So, of course, factoring into all of these timelines and projections is the need for people to get their second dose on time. And since you bring up the second dose, I'll just mention that the NACI, the National Advisory Committee on Immunization, has just yesterday published their revised recommendations for second dose timing, where they're allowing, given all of the operational realities that we're facing with limited supplies and the need to get a vaccine out as quickly as possible, that there is a little bit of a comfort margin with that 28-day dose. So we're all trying to get to stay close to 28 days, but recognizing that there is a 6-week allowance, as it were, where we can be very comfortable. It's likely a lot longer, but so far the evidence is very confirm that we have kind of a 6-week margin. That gives us a little bit of a wiggle room to play with, say, in either the scheduling to allow us to continue to use those doses, or for individuals, if for whatever reason they can't make that 28 days, we know that there is some comfort margin there.
Thank you. Luke, do you have a follow-up question?
Yes, I do. Just with all of that being said, is there sort of roughly a percentage of how effective just that first dose is with regards to protection against COVID-19?
Yeah, it's a great question, and it's kind of a complicated one, and I'm told that I need to hurry up a little bit, but so I won't take all day to answer like I would love to, but there is actually very good limited but very promising data that shows the first dose might actually be very effective. The problem is we then get into the how long is it very effective for, and it's really based on some of the evidence, especially from the Moderna trial, that if you take out the people who were actually incubating infection, because there were a few, while they got vaccinated, if you remove those people, you'll find that those who got their first dose were, I think it was in that 92% effectiveness for not getting COVID infection in the interval between their first and their second dose. So that looks very promising. Of course, again, that was almost like a byproduct. It wasn't one of the goals of the phase 3 trials, but you can say that first dose looks probably to be very effective, but for an uncertain duration of time. And we know that second dose is necessary to nail down. So we really need, and what that does is it gives that booster to the first dose, so it kind of solidifies the immune response, but it also then adds in that durability, so that then we know that we're good, at least for as long as we can follow. So far, we're good to 3 months, likely to be longer as time from those phase 3 trials goes on. We'll get more information on what's the expected duration of the 2-dose vaccination.
Thank you. We'll move to Danielle, CBC.
Yeah, hi. You were saying that, as more people get vaccinations, we can start looking at an easing of restrictions. One question I've heard is, once people are fully vaccinated, will they still need to quarantine after traveling?
Yes. So I will say, for the time being, everything is still in place, but these are really important questions, and they are being examined not just by our team, but again, these are national questions and even international questions to answer. So, and part of it really rests on that. First of all, real-life effectiveness. So we know that 95% is the expected efficacy of the vaccine. We also want to show that in real life. So as some of this experience gives us data, we'll be more sure of our actual on-the-ground, real-world effectiveness of the vaccine. The second, how long does it last? And what about transmission? How does it, can we be sure that it prevents asymptomatic infection and transmission? And so once we have more information on that, then we can start to apply it to, okay, well, what does that mean for travel? What does it mean for quarantine? What does it mean for when you're a contact of a case? There are really so many questions that still require clarity, none of which should stop us from getting vaccine into arms, but these are things that I think will become more clear as we get more data and then do the appropriate analysis to then go back into all of our policies and public health measures and hopefully revise them accordingly.
Danielle, do you have a follow-up?
Yeah. I guess to clarify what you were saying there is just that there will be no changes to self-isolation as of yet.
Correct.
Move to Chris at CBC.
Oh,
Sorry, Danielle, did you have another question?
I believe Danielle had a further question there.
Okay, we've just gone back.
Yeah, that was just a clarification.
Sorry, Danielle, please go ahead.
Could I ask my second question?
Yes, please go ahead.
Okay. We're seeing people in the Facebook comments asking about what constitutes as being high risk, what constitutes as being a vulnerable person. Say, for example, if you're 18 and immunocompromised, if you're younger and you have chronic illness, can you kind of lay out a bit what it means to be part of a high risk or vulnerable population that's going to go first? Are there any things that people are going to have to meet or any forms they're going to have to use to prove this?
So this goes back into to what I was trying to explain by exactly what we mean by vulnerable in terms of the schedule going ahead. So all of those, and again, there are many ways that we can kind of slice that in terms of who is vulnerable. At the same time, we are trying to get our whole population vaccinated in as quickly a time as we can manage with that goal of 75% of the adult population. So really that we in some ways we don't really have to go into the nuances of trying to make those decisions because our primary focus is on age, going through those age gradations, and then going into the mass immunization when people will be able to make their booking at convenient times for them, and then we can go through the whole population, and really the ultimate goal again by the end of March into the beginning of April to have everyone that is coming forward taken care of.
Thank you. Now we'll move to Chris from CBC.
Thank you. I'm interested to ask, I guess, both Dr. Hanley and Premier Silver just about the issue of rolling out the vaccine in particularly some of the smaller communities. What sort of challenges are you seeing in terms of both communicating to people in the smaller communities and also to nail down places that are suitable to run these vaccine clinics?
Yeah, I can start. Excellent question, Chris. Interestingly enough, I just got off the phone with a particular individual in a particular community who's on the other side, in that community helping with the vaccine rollouts. And it's things like some communities have gone through civic addressing, some communities haven't. Making sure that we have information getting out to people that are maybe less social than others as far as their ability to access social media, those types of things. The good news in those conversations when I'm asking these individuals how they think it's going, the first thing they say is the impeccable job that the team is doing to relay information, and it takes that community to receive that information. So the information being passed from chiefs and councillors and mayors and councillors, we really are relying on them to help us with the outreach to the communities. We've heard mayors being interviewed on your channel in this week as well, talking about, again, helping us to say, when it's my turn, of course I'm going to get the vaccine, and promoting the efficacy and the safety of the vaccinations. But ultimately, yeah, every community is different. We have some communities like mine in Dawson City and in Watson Lake that have hospitals, and therefore more people in the community working in health and social services, working in the medical fields, and then other communities that have more limited resources. So I would say that each community has its own unique challenges and circumstances, and the way that these vaccines are being rolled out by having Beaver Creek and Watson Lake being a big and a small rural community, that will really help us to define some of the issues in these communities as we get into the bigger, into the rest of those rural communities as well.
Thank you. Dr. Hanley?
Yeah, I completely agree, and I'll just add, listening to Mathia Latini this morning on CBC, who is the CYFN COVID community connector operator sorry, Matthew, I'm forgetting your actual title, but you just seem to do everything for making things happen in the communities. And I think it just speaks to that important role that CYFN and all of the First Nations are playing. Of course, we have many direct conversations ongoing, but we also have these very involved, quite detailed, one-by-one community conversations that are happening as communities are getting close to their turn. The support of leadership. We also, these partnerships, I think, are just remarkable in how they're playing out and helping. But the Emergency Coordination Center of Community Services, they are sending in teams ahead of time to get ready for the immunization itself, in terms of getting the place set up, in terms of doing those, again, on-the-ground conversations. They've been incredibly supportive and helpful in just, venue selection and in conversation with the community, making sure the IT support is there. The more you learn about these operations, it's the complexities are amazing, and the fact that we're actually there and things are happening, it really is exciting. But takes literally takes a community to make this happen.
Thank you. Follow-up question, Chris?
Yeah, I guess the follow-up is, could you be specific about, I guess, what the sort of baseline needs are in terms of infrastructure or space, in terms of establishing a vaccine clinic, and then to tack on to that, how many communities is this going to be an issue in terms of finding adequate space?
Yeah, I could start if you want. Yeah, I mean, I look at it as a big parallel going back in time to when we were getting businesses to start rolling out again and having guidelines and plans at that time. It's a matter of folks that are in line, making sure that they are in the right protocols for being in line, people that are waiting. Again, establishing the online booking system is key as well, so that people aren't all showing up at one time, making sure that people are safely distanced, those types of things. We really wanted to have a conversation, and this was, under the guidance of Dr. Hanley. We need to talk to the First Nations and the municipalities first, and then work with them to establish where these clinics are going to be best suited in each of those communities. And I think that was basically just coordinating in the same way that we did when it came to businesses being able to reopen safely. We now have to identify buildings that are safe, secure, that could also have guidelines in place and signage in place, and making sure that we do everything we can to keep not only the clients, the folks that are coming in to get the vaccine safe, but also the frontline workers who are either doing the administrative side of things or the injections themselves.
Yeah. So again, just to elaborate a little bit, if you think of how the Whitehorse flu clinic at the convention center, and then really just scaling that down, but all of those elements need to take place. So you need an agreed upon space that's adequate to bring in the number of people that is necessary, and to allow that COVID safe flow to occur. So of course you also need people to do that. It's not just the immunizers, of course, it's the greeters and the security and the support to allow for that all to happen efficiently, so that people are taken care of rapidly and get their shot and then have their little 15 minutes to wait, and then they're gone. And so the booking process plays so importantly into that, so that people do have a time. The IT support, we have a live registry, so every immunization is ideally entered as the immunization takes place, so that IT support and then backup plans for should there be a failure of the technology or the web, that you do have those backup plans in place so that you don't lose your data. Of course, then the communications that goes into it, which is all of what we just talked about, the upfront conversations, ongoing conversations, the written materials, the websites, all of that. So,
Thank you. We'll move to Marine à Roboreal.
Merci, je n'ai pas de questions aujourd'hui.
Merci, Marine. We'll move to Tim at Whitehorse Star.
Yes, hello. My question is probably more for Dr. Hanley, but anybody can answer. So my first question is, when you talk about the booking process, what happens if, say, you're a new resident of the Yukon, you don't have a Yukon health card yet, or any of the people who might want to slip in from the peripheral BC communities that are allowed in, can they come in and get a shot? And if so, how do they arrange that?
Yeah, so there are two parts to that. So really, most people living here have a Yukon healthcare card. So that's kind of really the baseline. But we realize that yes, not everyone does, and if people are living here or working here, then they are going to be eligible. So there are other. If you don't have your healthcare card, but you have a provincial card, then you would use that one, or some other way of establishing identity. So really, you can be counted, you can be supported for your second dose, and get all of the right information and the consent and all of that. So the second part of that was, we do have service agreements with places such as Lower Post and Good Hope Lake so those communities will be covered as part of the Watson Lake community visit. And then we have other places where we don't have sort of written contracted service agreements, but we are working out ways to ensure that some of those border communities are also covered. And so some of those conversations we haven't completed yet, but we are working really hard to ensure, for instance, that the people of Athlone have access to vaccine as well. Of course, they are in another jurisdiction, so it requires a lot of very close coordination with our counterparts in BC Northern Health.
Do you have a follow-up, Tim?
Yes, I do. Again, this is probably for Dr. Hanley. I've had a couple of readers contact me who are concerned about allergic reactions to the vaccine, and they're having some trouble getting the information they need. So especially if you have a history of allergic reactions, if you go into one of these clinics, are the people there going to be prepared to deal with any potential serious or severe allergic reactions?
Yeah, absolutely. And I think if you now look online, because again, some of the information is really now becoming more and more is being posted as we get this information gathered. There is kind of a two-pager, you might say, on the Moderna vaccine, including what to do about allergies. Any site that offers vaccine also has the ability to treat allergic reactions on the spot. And that's whether it's an anaphylactic reaction or a few hives. So there are the precautions are for Moderna is that if you have a known allergy to Moderna, which of course most people won't, or to any of the components. The main component of concern is what's called PEG, which is a kind of one of the carriers of the vaccine. And so if people have a known allergy to that, then they would be advised not to take the vaccine. The other components are actually really very few. And I think that's why allergic reactions, serious allergic reactions, are actually proving to be rare with Moderna. But we know that is always a risk with any vaccine, is the risk of a serious allergic reaction, and that's why we have epinephrine. That's why any immunizer is trained both to recognize and to treat an allergic reaction on the spot, and then appropriate measures take place for whatever care is needed after that initial response.
Thank you. We'll move to Claudiane, Radio-Canada.
Yes, first question for the Premier. Wondering if the money announced today by Ottawa for Indigenous communities, there's a lot of money in there. How much money the Yukon is getting? How much is new money, and what will it be used for?
I don't have that information in front of me right now, Claudiane, so I can't answer the question.
Okay, I would like by email if you guys get the follow-up on that bill, $4.2 billion that was announced. this morning by Minister Miller for Indigenous communities. Second question for Dr. Hanley. I'll ask in English for the benefit of my colleagues, but I'd like the answer also in French. Wondering if eventually, and if not, why not, if pharmacies, doctors, medical clinics, home care nurses will also be called in to distribute the vaccine.
Okay, I think you're putting André out of a job here by he's giving me his thumbs up. Donc, je vais essayer d'expliquer. Oui, on a certains pharmaciens qui sont déjà inclus comme provisionneurs de vaccins. Donc, mais vous parlez plus de la distribution de vaccins. Et donc, on attend que probablement c'est plus pratique avec les produits pour l'avenir, les produits à venir, qui sont beaucoup plus faciles, qui sera plus facile pour nous pour faire la distribution. Par exemple, le produit AstraZeneca qui a des conditions de mobilisation, de réfrigération, plus comme les vaccins normaux. Mais avec Moderna, c'est tellement spécifique les conditions de congélation, de distribution, même quand on sort le vaccin de congélation de moins 20 degrés, il faut minimiser les mouvements parce que chaque mouvement, ça risque de manque de perdre la puissance du vaccin. Donc, c'est les conditions tellement étroites, tellement strictes, qu'il faut vraiment centraliser la provision de vaccins pour cette campagne. Et c'est pour ça qu'on fait le maximum de centraliser aux centres de convention, à part les efforts dans les centres de soins prolongés, et puis avec les équipes mobiles. Logistiquement, c'est très compliqué selon les précisions du compagnie de Moderna. I'll just translate quickly, just that the question is about distribution to doctors' clinics and other pharmacists and other places. This is not a vaccine that lends itself to that kind of peripheral distribution, just because the conditions are so strict for storage, for keeping it frozen, for even movement. Even though even though it is a lot more flexible than the Pfizer product, which is why we chose Moderna. It's still very strict in how it can be moved around once you get to a location. And I guess the other thing which I didn't mention in French, pardon, it was that we do not want to waste a single dose. We have an obligation to aim for zero wastage of dosages, and because the vaccine is so precious at the moment, and so we are very, very sticklers for detail, and that's why we have centralized this as much as possible. Apart from the mobile teams taking it to the communities, the long-term care, and the efforts at the hospital. And the hospital, as of today, is doing a great job in how they are giving vaccine to their own frontline staff.
Thank you. We'll move to Hina, Canadian Press.
Hi, how are you, Dr. Hanley? I was wondering if you could just clarify for me that you said the territory could reach herd immunity within 3 months. Is that with both shots or with just one shot?
Yeah, thank you. So that the aim is for that's where all the second dose planning comes in, but that is to be fully vaccinated means you have your 2 shots. So our aim is for the end of March. I always give a little wiggle room saying into the beginning of April because things always happen. But really that is our aim, is first quarter or early into the second quarter success at achieving that 75% uptake amongst our adult population.
Do you have a follow-up, Hina?
That's incredible. It'll be the first place in Canada to have that. And I was also wondering if you could tell me whether you are looking at, or if the government in Yukon is looking at, although the first case was officially on March 22nd, how far back do you think Yukon had the COVID virus transmitting or being in the area? How long do you think it had been, it went undetected?
I think about March 21st. It's hard to say. I think that we were very, probably, the risk at that time was because there was a rapid surge in the southern provinces. There is a possibility that there was an importation and that it was treated as a kind of everyday influenza illness and not otherwise recognized. I do feel, but I think if that happened, it happened to a limited extent, because what we did not see was suddenly unexpected areas where transmission was occurring. We didn't see, hospitalizations popping up, all of those things that you would have expected to see and which other places in Canada did see once they sort of had that undetected and beginnings of community transmission. So I think it's quite possible that it occurred and we missed it, but I don't think it occurred actually that much. So I would be surprised if we had significant activity before February, March. This study may help us to determine that, or to sort of lean us one way or the other.
Thank you. We'll go now to Haley, Yukon News.
Question I had earlier, it was mentioned that obviously to getting to 75% depends on the vaccine doses being delivered as scheduled. Is there any concern about that at this time?
I think every jurisdiction is going through the very similar concerns, and I don't just mean in Canada. We had conversations with the Prime Minister about his trepidation, making sure that when they get delivered, they're being expedited as safely and as quickly as possible. With Moderna,
We can't hear the question.
can you hear me answering? The question was if we have any issues on the distribution and the timing of the distribution in the first quarter. What I've been seeing from all accounts, though, Haley, is things do get expedited as opposed to we're being worried that things are slowing down as the supply chain management gets figured out internationally. As Moderna takes a look at which countries are ready for second doses, we have no reason to believe that whether it's in Canada in Yukon or in the rest of Canada, that the medical teams right across Canada will not have the ability to get these vaccines in people's arms as quickly and as safely as possible. With that being said, we still have a long way to go in making sure that we can nail down the dates of those final doses. So we do know that there's another 7,200 arriving this week, and we again have been communicating. I communicate with Dominic LeBlanc and Christy Freeland, the federal ministers, and the Prime Minister, in our calls, and we're all facing the same things in each jurisdiction, other than in Yukon, we do have that commitment of having the vaccines front-end loaded compared to other jurisdictions. So when we're trying, to echo Dr. Hanley's words earlier, we're not going to have to go too far down critical workers into essential workers and prioritizing, because the general population, through vaccinations and understanding of those scheduled deliveries, will catch up to that process, and then we'll just have general population folks in line for vaccines.
Next question, Haley.
Yeah, actually, I have a real follow-up question this time. I wanted to know, there is another delivery happening this week with 7,200. Have there been other delivery dates confirmed? And if not, what's preventing those firm dates?
Probably a good question for Ottawa as far as those firm dates. we've had preliminary conversations about the distribution of Moderna in Canada. And every time that we get updates, we do get good news. And you've been reporting on, more vaccines than what we anticipated delivering and it being delivered in Canada. So again, I don't see a lot of alarm to think that we're not going to get our vaccines in the first quarter, but I do agree with Dr. Hanley. We might have to allow for some flex room for the distribution of those if we get those our final doses, in the end of March compared to the beginning of March. But all signs so far show us getting vaccines quicker than what we thought in December, as opposed to worrying about getting it further than that. I know I've always said that I would have loved to have gotten the vaccines all delivered right away, but again, that was, we have our 72 and our 72 delivered now, and we're going to continue to work with Ottawa to make sure that as they get delivered, they get vaccinated as quickly as possible, because we now have the training in place. We now have, the safety considerations that are specific to Moderna figured out. So as they arrive, we'll be able to every week get them out even more expeditiously.
Thank you.
Thank you.
I'd like to thank everyone for their time today. The next COVID-19 update will take place on Wednesday, January 20th.